Hey guys, I'm David.
And I'm Steve.
And every week, somebody writes one of us and tells us about a brand new, revolutionary new hair transplant technology. And today, I wanted to take you through a few that I've recently heard about. And we're going to kind of do a one versus the other. And Steve actually knows a little bit more about each one of these from a technical perspective than I do. So he'll give you a little bit of the technical perspective of what's going on with these techniques. Now, they're all FUE, or follicular unit extraction techniques, meaning that there is some kind of punch or incision or something. They use some little tool to extract a graft or a follicular unit, a hair, for lack of a better word, out of the back of your head, and then place it on the top of your head. So all of that's the same with all of them. But this is FUE, just traditionally what we call FUE, which is some form of that, versus we're going to do DHI, this is one, Smart Graft, Safe Graft, and Ugraft. Now, you'll realize, I think, by the end of this, that there's a trademark name for basically every surgeon and punch tool thing that you can find, which is kind of funny. It's actually a little bit funny. But anyway, we'll take you through this whole thing. Let's start off with DHI. There's actually, from what I can tell, is one of the more unique, actually, in a way, than the other ones. So DHI, let's go ahead and read. It says, direct hair implantation is the world's best hair transplant technique. I think they all say they're the best.
Probably.
But, yeah. It is powered by the triple synergy technology. That's a really fancy term. Teamwork and technique. It is offered exclusively by DHI Global Medical Group. Well, of course, you'll find out as well that every one of these methods is offered exclusively by the people who sell it.
Exactly.
Also, I just want to say right off the bat that all of these methods, I'm sure, can produce excellent results in the hands of an excellent surgeon who has had lots of practice with them. I think that probably everyone could produce excellent results on especially the right candidate.
Absolutely. It depends on the technique. Really depends on your specialist, your surgeon, who feels most comfortable with that specific tool or technique. Mm-hmm.
Being comfortable with that. Right. So one of the top surgeons in the world who has had, incredible results. Let's use like a Dr. Bolbach, who our friend Dr. Daniel McGrath, he is a hair transplant surgeon. He actually went to Dr. Bolbach to get his surgery done because he's such a world-renowned surgeon. And that surgeon uses an older version, basically, of a punch technique.
Yeah, it's a manual punch. So, it's a lot like when you go to a dermatologist, mm-hmm. and they have to take a little biopsy. God forbid, there's something wrong with your skin. They take a little punch. It's a little incision, and it clips a little bit of skin, and that's considered a biopsy, a punch machine. It's mm-hmm. handheld. It's pretty easy to do. You put a little stitch in there and you're done. Well, that's what Dr. Bolbach uses as his chosen method, which is, if you want for the internet, that's pretty basic.
Yep. Gotcha. So, and was that basically the first tool that was kind of used in FUE?
Well, if you go back to the days of the plugs, they used to use an actual drill. That was
after the plugs.
Yeah, pretty much.
So it's kind of the original FUE tool?
Yeah, the original FUE tool was because you never really needed a lot because you were just trying to fill in a little scar or something. That's where it all started. So you only needed a handheld device because you didn't have to have any speed or anything like that. Okay. So that's really what it was, yes.
Cool. So that's a surgeon right there that's, again, world-renowned. He did Perez Hilton's recent hair transplant and stays totally booked. Even doctors are going to him to get their hair transplant done.
It's experience. It's talent. Mm-hmm. A lot of this is skill set. It's 50% science, 50% skill. So an artist, you as an artist know that not everybody's an artist. I can't play the guitar. Yeah. At least not very, very good. So it really comes down to the doctor, his skill set. Then you've got patients with all different types of variables, mm-hmm. and that has to be played into which instrument, which we'll probably get into when we talk about another doctor and what his instrument is, but that's more for like African Americans, which shape to the curl inside the scalp. So there's so many variables with so many different types of hair that it's not a one-size-fits-all industry.
DHI, we've gone through them just a little bit. Now DHI, can you go through a little bit of the technicals of what they're doing or what they're selling with this this technology and skill or whatever?
Sure. So, they're trying to, of course, brand this. And I'm friends with, I know a lot of technicians in the industry, not the doctors, but the technicians, where there's a lot of labor involved. They refer to this as injectors. Now, what an injector is when you have an extractor in the back taking the hair out and an injector putting the hair in. So the technique or the protocol is that as you're pulling out the grafts, you automatically pass the same machine to the front, so it's injecting. So you're extracting, injecting, extracting, injecting. Not a bad idea, because if you have a limited staff or you have an inexperienced staff and you have a gun to your head, you're definitely going to use this technique because there's less handling of the tissue.
Yep.
So it's a great concept. I'm not a big buyer in where no matter who they train is a world-renowned hair transplant surgeon. That's a whole nother conversation. But this is actually not a bad way of doing FUE.
Cool. So next we're going to go to the SAFE system. Now, from what I've researched with the SAFE system, they're a little bit less extravagant in their use of terms. So some of these systems, you'll realize they just kind of go all out with the marketing terms. We got the triple synergy, like painless, most natural, 100% everything grows. You get all your donor hair back at the end. They just kind of go all out, like every term they can throw out. So the SAFE system, it doesn't really seem like, at least on the couple of different websites that I read about it, it doesn't seem like they kind of go off the deep end, which is nice or refreshing anyway. So it says, SAFE system developed by Dr. Jim Harris is a device that uses blunt dissection to isolate the follicular units from surrounding tissue.
To go back a second on how it's marketed, I think this is more of marketing, in a way to a user, meaning a doctor, not so much the end user, the patient. Now, the other one, DHI, was really trying to woo you with their amazing world-renowned technology.
Yeah.
What this is doing is this is something where an actual doctor created this and had a lot of success with it. So the blunt part of it means that when you go into the back to make a pass, which is there's two ways you can do this. Well, there's many ways you can do it, but there's really breaks down to two there's a pass which goes into the tissue, which picture like, your sheetrock wall, it kind of cores out the actual hole, and then somehow the graft has to be lifted out and kind of pulled away from the supportive tissue. Yep. So the different types of kind of like diamond head and all that stuff that they throw out there is all what will cut smoother and not rip as it goes in.
Yep.
So I guess we could compare this to, if we're going to go back to the sheetrock, which makes the cleanest cut. So that would come down to the carpenter that is really good at using tools and decides that his cut is perfect and it's based on this type of drill bit or whatever you want to call it. That's really what it comes down to. So the SAFE, I'm familiar with it. I think it's a great tool based on also the workload of the clinic. I'm used to working with these doctors in my network personally, in our network, that do very low volume procedures. Yeah. So not that this can't do a higher volume, but it's not going to be the fastest machine because, when you're doing 3 FUE surgeries a day, not only is that big money, that's a lot of labor.
Yeah.
So that's where we're going to talk about other machines that are more geared toward selling it to a doctor where they can make, they can take out twice the grafts.
Yes.
And that still requires a lot of skill. So it's not the machine, but it's the doctor who's using the machine.
Next, we're on to the Dr. Ugraft, another trademarked FUE hair transplant system. It says Dr. Ugraft is a revolutionary hair transplant system built to empower doctors and transform lives. The system features a set of uniquely designed devices that have completely changed the game, like all the other ones, when it comes to FUE hair transplant procedures. These features include, but are not limited to, the Dr. U punch, again trademarked, the intelligent punch. I'm not going to go through every single thing about this, but makes a paradigm shift in FUE, ground-breaking features, all this kind of stuff. The Dr. Ugraft Nurture, an ergonomically lightweight rotary handpiece that makes it possible to connect the intelligent punch to the Dr. U revolutionary console. The Dr. U Revolution console is another machine. Revolutionary console with an integrated fluid hydration system and 5-speed RPM settings. When used with the Dr. Ugraft, Nurture, and Intelligent Punch, the console also gives the operator the correct setting for the patient's skin and hair type. We're not going to get too much into the Dr. Ugraft technical aspects because I'm not very aware of them, and neither is Steve. Again, all of these machines, I'm sure, can do excellent work in the hands of the right people. But I wanted to get here to where they talk about with the Dr. Ugraft, the GET training. So it says, too often providers interested in FUE hair transplant struggle to find hands-on, lifelike surgical training. Well, that is true. That's what we've noticed is the problem, is that with all of these devices, many doctors are sold the device, but they actually haven't had any training on how to use the device, or maybe like a day or two with, someone telling them how to use the device. And that's the problem, is it's just a machine that they're like, okay, cool. Well, if anyone ever walks in the door and needs a hair transplant, now I've got this thing that's supposed to do it. So we agree with that. Then it says, while there are many hair transplant courses offered in various workshops, these are often lecture-based and conceptual. Many times, attendees return to their practice from a hair transplant course or workshop, lacking the confidence to begin offering FUE hair transplant procedures to their patients. Again, this is really the problem. And they're stating it on their site where they're offering this machine to people to buy it. So again, what they're offering is they say, Dr. Ugraft takes these considerations into account, which is why we invite those who purchase our devices to come and learn how to use them from the creator, Dr. Sanusi Umar himself. So that's cool that they offer this training. You can go in and learn from the doctor himself. It seems somewhat contradictory because on the one hand, the first part of the paragraph is saying, hey, here's the problem with all these devices, the Neograft, Artas, SmartGraft, SafeGraft, Ugraft, DHI, all these things. Here's the problem, is a lack of training. And they're kind of saying that in the beginning. They're saying, hey, we know there are all these different machines out there and people aren't really getting trained and they're buying them. So they say that. And then at the end of their paragraph saying that if you buy our machine, you can come get some training. It's like, that's great. But what about, Dr. Umar, if you're watching this, how many years of training did you do before you even invented this device? How many years of training did you do before, maybe, I'm guessing probably with another hair transplant surgeon before you even started to do hair transplant surgery, where you'd have lots of experience. So, it's awesome that, their people are making a lot of money by selling these devices, but I feel like he's kind of addressing the problem and creating it at the same time. Now we're on to the SmartGraft. So FUE with SmartGraft poses countless benefits over the older strip method of hair restoration. So it's no wonder that many patients are asking for SmartGraft. Among the benefits of a SmartGraft procedure are, and then it goes through them, and I thought this was pretty funny because it says among the benefits of SmartGraft, and it's comparing them to the older strip method, which doesn't have these benefits. It's kind of saying, and then it goes through pretty much all benefits of both procedures. It says a completely natural look because your own hair is used to fill in balding spots. The results produce the most natural, healthy look possible. But that's true with FUT too. Exactly. It's your own hair. So I don't feel like this is a benefit of a SmartGraft. This is just the same with a strip procedure. Minimal scarring. Okay, here you go. This is unlike the other traditional procedures. It's talking about FUT or strip procedure, which require large strips of hair to be removed and restored. SmartGraft uses individual micrografts to eliminate linear scar. Okay, I'll give them that. That is a different kind of scar, a different benefit. Okay, so then it says a single in-office procedure. The procedure is performed in the doctor's office and typically lasts about 5 hours. Well, actually, that's exactly the same as with the strip procedure. It's a single in-office procedure, or at least to get one procedure, and it typically lasts about 5 hours.
And the reality is a strip, if it's done right by a specialist, it's probably 25 to 30 minutes to remove as much hair as you want, or that can be removed safely and closed safely, perfectly. Whereas FUE, the average extraction is going to be 2.5 to 3 hours. So that's actually kind of the opposite.
Yeah.
But it's still in for one day, but it's much more time consuming and labor intensive to do FUE.
Yeah, I think my huge strip procedures where I had a ton of tissue taken out, I think only lasted around 3.5, 4 hours. Right. So it's actually even shorter than that. So that's not even really necessarily a benefit. So, all right, so almost no downtime. Recovery is short, and patients are typically washing their hair within a few days. I mean, with a strip procedure, there is probably a little bit more downtime, but it's not that much different. What would you say? I haven't had an FUE procedure, but yeah.
Downtime, it depends on how much of a active person you are, because there are limitations to the activity with a linear procedure.
Yes. So you can't work out as fast.
No question, 10 days. And if you have any concerns about any stretching of the scar, it could be as much as a couple months as far as heavy weight. So that's an issue. That is a concern. FUE doesn't have that. So that is a benefit for FUE. However, you got to shave back if you do it right, you have to shave the whole back of the head and over the ears, because the whole object with FUE is to have the look of less scarring. It's not less scarring, it's different scarring. So when you shave everything and you pull hair from a wider area, when you shave your head in the back of your head after it all grows in, you won't be able to pick up the dots.
Yep.
I mean, I've seen some mistakes made, a lot of mistakes made, where these doctors, they'll buy a machine, have no idea what they're doing, weren't trained, and the person doesn't want their head shaved, so they'll comb the hair up and they'll take out this little rectangle and they'll take out the entire harvest area inside that rectangle. So now they have no hair there.
Oh my God.
So they have this huge area void of hair.
Oh man.
And I'm like,
it's like worse than a strip. It's like a giant strip.
Yeah, that's a bad example. But anyway, so point is that there is advantages to FUE when it comes to the downtime.
Quickly, we're going to go over Neograft and Artas. Now, I'm actually just going to read this off of a surgeon, and I know nothing about this surgeon, by the way, but I just thought this was a pretty well-written article. And so this surgeon, his name is Dr. Verona. I think it's Christopher Verona, if I remember correctly. I came across his website, and he does manual follicular unit extraction, so basically traditional FUE. And then he talks about, this is Christopher Verona, and then he talks about on his website the Neograft and the Artas. And I thought it was kind of well worded. So Neograft is a type of follicular unit extraction, but instead of your surgeon personally performing the graft extractions, as Christopher Verona does with his manual extractions, a specialized device is used. The device has a piston driver driven motor and uses pneumatic pressure to essentially suction out the individual hair grafts. It then applies controlled pneumatic pressure again to insert the grafts into the scalp. This treatment is initially attractive to patients because it does not require scalpel incisions or sutures. However, the suction action of the device can potentially damage the hair grafts. It also uses a larger punch size, which may result in visible scarring. While it may achieve a higher number of grafts in one session, it offers much less control and precision when compared to manual FUE. Patients should also be wary of unqualified technicians performing this procedure. Some clinics have doctors who do not specialize in hair restoration performing the entire process. The hair restoration in general requires meticulous surgical skill, and you should only trust an experienced surgeon to perform your hair restoration procedure. So I felt I'd read that off of his website because these are not our words. Because sometimes I feel like we're just saying the same thing over and over. So maybe it's nice for you guys if you've watched a bunch of our videos to hear it from someone else. Then it says Artas. Artas is another technology that some surgeons use for follicular unit extraction. Theoretically, the Artas system has an advantage because the robotic device cannot become fatigued during extractions. However, this very crucial step requires the kind of artistic insight that is only possible when an actual surgeon is performing the procedure. Extraction with Artas is also much slower, and it doesn't offer the same level of precision required for optimal aesthetic results. Artas typically uses a larger punch size when extracting the grafts, which can increase scarring. It tends to be limited in its ability to maximize the potential donor areas fully.
So David, in essence, really what this comes down to is this is like we talked about, 50% science, 50% art. The artistry part of it is very touchy-feely. It's very much a skill set where, as good as these doctors are, you can walk into their office, they can run their comb through the back of your head. Until they get in there, that's the time when it really comes down to what kind of tissue you have, what kind of hair you have, and how those grafts are coming out. So when I say touchy-feely, for instance, the better doctors, the top doctors, most of them do this by hand, and those same top doctors would never do surgery on anybody who's not qualified for FUE. With that being said, if these doctors go in there and let's say they had a bad day, let's say evaluated their patient in the morning wrong, and they start taking out those grafts and they're falling apart, they're going to stop that surgery, tell that patient, I'm sorry, you're not a good candidate for FUE, I've made a mistake, and give your money back. That's what you want to search for in a doctor. It's the doctor, his work, his results, his experience, not these tools.
And their reputation, you know, being willing to go, you know what, I need to stop this. Here's your money back. And yeah.
There's on some of our other videos, we talk about what your doctor's going to tell you if something goes wrong. This is probably the biggest thing that can go wrong with an FUE. Okay. I'm not going to mention any countries or any clinics or anything, but guys walk out of some of these clinics and their head is all scabbed up and they've got 5,000 FUE grafts. And I'm like, 5,000 grafts.
So you've worked with surgeons that have stopped FUE surgeries mid-surgery and just gone, you know what, like I've realized after taking out a few grafts, this is not going to turn out well for you?
It's rare because normally what can happen, which can kind of go wrong, is that in the morning, like let's say for argument's sake, someone's coming in from Northwest into, you know, Miami, okay? And their photos look really good and they've done a video conference with the doctor and everything looks really good. And in the morning of that procedure, that doctor goes back there and feels that guy's hair and it's baby fine. And it's really soft. That doctor knows those grafts aren't coming out good.
Okay,
so he's not going to do that.
So you have had quite a few patients come into the office and then realize when like Dr. McGrath's, for instance, felt their hair, they were like, man, this is really, you shouldn't do this.
It's happened twice. In 7 years. And that's before the surgery even started. Okay. But when you're communicating with the patients for a doctor like Dr. McGrath and his colleagues that are also top of the line, is they're going to tell you that if they get in there and they start making these passes, and when they're pulling out those grafts, if that hair's falling apart and it's just a bunch of mush, they're not going to do the surgery. And that's something that you need to hear out of the mouth of your doctor prior to going in for a procedure.
And we feel like if you're going, you're going to another country and it's not a really experienced surgeon, or even within our own country, it's not a very experienced surgeon that is doing this procedure, then you're really putting yourself at risk, because that person that lacks that experience, or is just, let's say that they're working for a large clinic and they're just getting a paycheck for that day for showing up, and it really has very little to do with their individual reputation. They're probably not going to feel your hair and tell you, hey man, I know you flew in from wherever, but you need to go back home, or hey, I know you drove in, but you need to turn around and drive back in your car.
And forget about foreign countries. I've seen it with my own eyes here in this country. The largest company out there, and I'm not going to name any names, but they're run by business people and they use the doctor's licenses and they have franchises throughout the country. That doctor starts turning away too much business on the morning. They turn away 2 out of every 5 surgeries or 1 out of every 4 surgeries. They get a phone call.
Yeah.
Hey doc, we need the revenue. And you know how that goes. So yeah, you want to understand it's not that easy, especially to do FUE.